You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. Also, extreme smile makeovers. With us, we have Tennessee's dentist, Dr. Hayes. Dr. Hayes, welcome to the program.
Thank you, Randy. Glad to be here.
Now, before we get into today's topic, for people that don't know you, because you have a very large practice, who's a typical patient? What are the different procedures you do? And I guess you also work with your wife. We've had her on the program.
Yes, thank you. Actually, I don't know if we have a typical patient. We have a full range of patients, all the way from a toddler to 100-year-olds plus.
Is that right? 100-year-olds are going in there?
Every once in a while, yeah.
Okay.
Every once in a while. We see more of that all the time. Actually, what we do throughout the day is we do exams, we do cleanings, we talk to people about their smile, about changing their life. They don't know they're coming in to change their life a lot of times.
Is that right? Elaborate on that.
Well, they want a little chip fixed, or maybe they just have always wanted to have a nicer smile and they're not really sure what they want. So I sit down, I talk to them, and I can see already what it's going to look like afterwards.
Okay.
Yeah, I know. Oh, a little bit here. Oh, man, this is going to be great. So.
But you say they don't know how it's going to change their life.
I don't think they do.
So when it's all done, what happens?
Well, when it's all done, they're like, I can't believe this. If I'd only known, I'd have done this years ago. And this is an example right here. This young lady came in.
All right.
Alta. She had saved her money all of her life to fix her teeth. She had never been happy with her teeth since she was 20 years old. So
is that what they tell you on the consult?
Absolutely.
Okay.
Absolutely. Been waiting all my life to have this. So she said, I want this done. I want that smile. So you can see in this situation.
Yeah, when you look at that, what do you see?
Well, first of all, a lot of our patients, pretty typical, come in. They don't want to show their teeth. They're not used to showing their teeth. We have to kind of tell a joke, tell one of those good Tennessee colloquialisms. How about that dog? You know what I'm saying? And to get them to smile.
Okay.
Say, well, smile like you just won the lottery. And usually we get that smile when we say something about the lottery. Okay. But they have to force a smile.
Yeah, that looks a little bit forced.
Yeah,
as
absolutely.
You mentioned, since you mentioned it.
Sure. Her teeth are dark. She's had restorations done multiple different times. The corners of the mouth don't point towards the ears. The bottom of the top of the bottom lip doesn't follow the curved line of the upper teeth. And, she just doesn't look happy about smiling for the camera.
Okay.
And so we kind of have an idea. Sometimes I get surprised, too, how good it looks. But we kind of have an idea going into it, how good it possibly can look. She didn't like the smile before. And there's lots of people walking around that really, they don't like their smile. They look unhappy. They look angry. And you're not really sure if they're just having a bad day. But really, they don't want to show their teeth. If they do, it's one of these no teeth smiles.
Can you spot that?
What?
Walking around?
Yes, absolutely. Yeah, walking down, you're walking down the hallway and you're in the airport. People just got that weird look on their face and you smile at them and you get nothing back. And it's rare when you get that great big beautiful smile from people. And a lot of people need this. There's lots of people running around that don't know their options. They don't know what's possible. They don't know that their life can be changed. So
with her, what'd you give her? What'd you do?
Well, first of all, she didn't want to be awake for this procedure. She was going to have a lot of work done, and she wanted to be sedated. Not a problem.
Well, that's nice.
Not a problem. We do IV sedation, oral sedation, nitrous if we need it. For her,
you have a line that you say, by the way, for these patients.
Well, when I walk in and talk to somebody like Alta, I'll say, well, time to take a nap. And they're like, oh, yeah, that's great. Yeah, I'll actually love that. So when I walk in, before we first get started, we give them a little medicine, and they're gone. Time for a nap. And when they wake up 2, 3, 4 hours later, sometimes they say, are we done already? Are we done already? So after 2 appointments, we had Alta's top teeth done. Randy, put these side by side.
Okay.
Look at the difference in the eyes. Look at the twinkle that's in her eyes in this picture.
In the after, it's true.
Absolutely. There's a twinkle. Look at the smile. The areas, the corners of the mouth are filled in with teeth.
It reminds me of like you're showing me baby pictures with these. You're proud of this work that you do.
I am. Well, when they have that kind of result and they believe in it that much, yeah, it really was a difference for her.
Now, in your practice, by the way, do you and your wife both do kind of the same thing together?
Well, yes, we do in one way, but I've kind of leaned towards doing implants and the reconstruction and the larger cases, IV cases. Sandy is just an expert at taking care of people who need removable prosthetics. And
She's doing a lot of the denture wearers.
absolutely, the denture
fixed
wearers.
set of teeth with the dental implants now.
Absolutely, and the implants for them. She has thousands of those patients that just love her to death. And now we're getting those patients into fix dentures and to fix bridges.
Nobody likes going to the dentist, right? Do you hear that?
We hear that a lot. Actually,
They say it
people
to
say,
you?
yeah, they say, Doc, nothing personal, but I don't like dentists. And then I tell them what they're going to have done, and they say, you know what, you're going to have to knock me out for that. And that's when I knew that IV sedation and doing these larger cases and helping people with their whole mouth had to be a team approach. It had to be where Sandy and I were both working with these patients, and that we were able to do it with them having no memory, no pain, go home, sleep it off, and wake up the next day ready to go.
I think we talked in the green room. You said that because you guys have a big reputation for being the sedation, like one of the few general dentists around that do
Sure.
sedation dentistry.
Sure. Yes, between.
And they don't even know that you do like cosmetic dentistry and these other things.
We've run into that. I was shocked by a friend of mine not too long ago that said he went and had a procedure done at one of my other buddies' office. And he said, yeah, I didn't need to have sedation, so I just needed to have a crown done. So I didn't have a sedation, so we didn't bother you guys. I'm like, whoa, wait a second. Yeah, we provide, most of our patients are IV sedated, but we do thousands of patients throughout the years that have not been sedated.
So you're a regular general dentist
Yes.
and
Yeah.
cosmetic dentistry.
Yes.
Okay.
Yes. Cosmetic dentistry. Implants. We're providing dental care for sleep apnea. We do cosmetic braces.
You do adult orthodontics.
We do
Is that
adult
right?
orthodontics. Yes, absolutely. Let's see. Here's a great example right here. Can you even tell that there's braces on this?
No, just looks like, well, I can now
Yeah.
that I look at it.
Well, you gotta look up really close.
Okay.
Yeah.
So what, these are, you call this what? This is these clear braces, or what do you call them?
That's cosmetic braces using 6-month smile.
Okay.
So what we're doing in that situation is, now there's lots of people that have problems in the back of their mouth and in the front of their mouth, and regular adult orthodontics is perfect for them. This is a situation where by the next time you have a cleaning, your braces could be done. We've straightened your front teeth, the ones that show, the ones you really care about.
So kind of like cosmetic orthodontics. You're just moving the ones that are crooked in the front.
We're not changing.
right?
We're not changing your bite. We're not doing anything for the back teeth. We're not opening the distance between your nose and your chin, doing like what you would call a cosmetic facelift with dentistry.
Okay.
What we're doing is we're moving and straightening teeth. Sometimes just a few teeth, because once those first two lap over on the front, there's kind of a collapse, a domino effect that kind of rolls in behind there. And this is what I really love about it. Here's a picture of one of our patients that has got braces on. We had her on a billboard, and it was really kind of hard to tell.
Yeah, you can't tell. Yeah, it's very nice. Because I guess a lot of, I guess especially teenagers that wait, they don't want to have metal braces.
No.
In high school. But so you're getting the adults for, well, like what's the oldest patient now? At what age do you qualify for
The
this?
6-month smile is about 16 years old.
Okay, what about the oldest patients?
I don't think we'd have a problem treating somebody who is 70, 80. We can move a tooth.
Okay.
Yeah, as a matter of fact, here's an older gentleman right here. We did a combination of things for him. We did orthodontics.
take a look.
We did implants. Here's the before shot. Missing 2 front teeth, the large gap in the 2 front teeth. That was the most difficult part of this, was how were we going to close that gap?
And how many years did he go with it like that? He had nothing in there in its place?
The gap had been there all his life, 50 plus years.
Okay.
He had lost the other 2 teeth a few years ago and was wearing a removable partial that came in and out. Now, there's a lot of people, like Willie here, who didn't like wearing a partial that came in and out. It kind of clanked when he bit down.
Mm-hmm.
He always had to have it in. Who wants to remember to put their teeth in? You want them to be in there already. So what we did for Willie was we placed implants in the areas where the teeth were missing, single tooth implants. We used braces, cosmetic braces, to pull the 2 teeth together, and then we did veneers and crowns to close things out.
Very nice.
Yes, thank you.
Very nice. What does he say when it's all done?
I love it. I really like it.
Okay.
That's Willie.
So you brought a lot of photos.
Yes, I brought a bunch of stuff.
Okay.
Yes, and here's a young lady, 40 plus.
Okay.
She came to us. She didn't like her smile. She didn't want to have any dentistry done while she was awake. She had a bit of a yellowing teeth. She had flattened off her teeth. When you have flat teeth, Randy, that's telling everybody that it's old, that the teeth are old,
Okay.
and that you're old, and you don't have to have that. Also, she had a large gap between her teeth. Now, very European. A lot of people in America don't like to have the gap in their teeth. Now with Sherry, what I wanted to do right there was I wanted to give her a soft feminine smile. The bottom of the top teeth following the upper portion of the lip, a slow, gentle curve, fill in the gaps, and give her a nice, youthful smile that gave her the opportunity just to glow. And really she does. She just glows when she walks in. I may want to hold that back a little bit. This is pretty great.
Okay.
All right, there you go. So,
wow, very nice.
I mean, this looks like her younger sister.
Yeah.
So you see, now again, look at the pop in the eyes. Look how much happier she is. Look at the twinkle. Look at the twinkle in Sherry's eyes.
When you put the before and after side by side, yes, the eyes do look happier in the after.
Look at the corners of the mouth shooting back toward the ears. She was really just kind of showing us her teeth in this before picture. Here, she's showing us who she is.
So it's like a real smile.
I agree, absolutely. A real smile.
So is that what you
from
call
within.
it? They're just showing their teeth in some of these? Because you have to force them to smile, you say.
Yes, we actually take 2 or 3 pictures sometimes, say, all right, now smile for me. Oh, well, you're kind of just showing me your teeth. Okay, smile like you just won the lottery. Or smile like we've already finished your smile, like it looks the way you want it to look already. They start to picture it, and that smile actually starts to show up. Now, quite often, we have to work with patients afterwards to teach them how to smile. They haven't done it before. They've created muscles pointing their smile the wrong direction. Now they can crank it up.
Do you have patients, I mean, could they be too far gone? Because we're talking about extreme smile makeovers.
Sure.
I mean, you could take somebody with really bad teeth, really bad gums, and give them a nice set of teeth?
Yes, we can. You know, if, one of the phrases I've heard you say before, if they just have to go, you've still got a chance to have fixed implants. You've still got a chance to have teeth that are attached to your bone. There's almost no one that can't have implants. There's almost no one that can't have implants and teeth where they can bite off an apple, chew steak.
Okay. So you say you're changing people's lives. You see it all the time?
Yes, absolutely.
Because going into this, I always think it's just teeth.
Yeah.
You say it's more than that.
It is. One of my favorite things to do at the end of one of these situations is just say, congratulations, whether it's a single tooth or if it's their whole mouth. And they just beam. People love to be congratulated. But they know they've participated in this. They've worked hard. They've invested time. They've invested money to get this. And it's not always that first time they hold the mirror up and they go, because usually we get a tear. Even some guys every once in a while kind of tear up a little bit. When they get
right?
that. Absolutely.
They look in the mirror?
They look in the mirror and like, ah. It's when they go out and they've been with their friends and their friends go, yeah, that's great. They're coming back in for that follow-up visit and they're still beaming. They're still talking about it. And we say, hey, would you be a testimonial for us? Oh, I'd love to. We have people come down from another state. They come down from Kentucky quite often to come to see us. And I've got one patient that flies in from Las Vegas.
So you can never be too far gone.
I don't think so.
And small improvements. I mean, do you ever get people that maybe come in just for a gap and then they want something else, and then they want something else?
Sure. Yeah, they want one little thing fixed. And sometimes with one appointment, we can do some cosmetic bonding, and we can close a gap, fix a chip, smooth off something. Yeah, sometimes small fixes make a big difference for people's smile.
Why in this economy should you invest in your smile?
Well, there's no better person to invest in than yourself. And your smile, you know, your smile is one of those kind of things where you might be able to get something done in a couple of appointments.
Okay.
You know, you could have, you can get new clothes, you can get a facelift, you can have your eyes done, and there's lots of surgical procedures you can have done, but none of those is going to really pop and I think affect the rest of your being like your smile.
Really?
Yeah, really.
Well, you're a dentist.
Well, wouldn't I think that? Yeah, but there's lots of people who think that the smile is really what opens up your personality. It allows it to come out.
You know, on that show, Extreme Makeover, you know, and we're here in California, and I saw one of the plastic surgeons on the show was interviewed, and he said that the biggest change in their appearance was their smile.
Really? I think he's right.
And I'd have to agree with, you know, with looking at some of the, okay, you have some more photos.
Sure. Here you go, Cindy. She wanted a more youthful smile. She wanted whiter teeth, and she had some broken areas, some old fillings that needed to be replaced. And this was sharp. I mean, you know, this is also very typical. We see people come in, their hair's different, they look younger, they drop a few pounds. I don't know that she lost any weight. She just looks like a younger person of herself.
So you have some people that you change their smile and they start dressing differently and acting differently.
They're a different person. They feel better about themselves. You know, it's just kind of an energy that starts to flow. I think really when you smile, You're a Tony Robbins guy.
Okay.
Heard Tony Robbins say one time, some guy's just depressed, stick him in the corner, make him smile for about an hour every day, and then those things come out of you. The chemicals come out of you. Starts firing your brain. You're feeling better. Depression goes away.
It's hard to be miserable
Happiness.
when you're smiling.
It's hard to feel bad when you're grinning. Yeah, I agree.
Do you meet people like that? They come in and you size them up, like they look mean, but they just are hiding a smile under there that they're ashamed of?
You know, a lot of times people come in, they're just in pain.
Okay.
Yeah, they're just in pain. They've broken off teeth. Their nerves exposed. They've been clenching and grinding and breaking off teeth, and their jaws hurt, and their head hurts, and their TMJ.
So they don't care about the appearance. They just want to eat. And
They want to eat. They want to bite off that steak, corn on the cob. You know, they go hunting and bring in all that good game. They want to be able to eat it.
Okay.
Okay. Now some people come in and they're not able to eat, and they're more interested in function instead of aesthetics or the looks. Then they go home and they get that first compliment. Say, "Wow, you got a great smile," and then they realize they're getting a lot more than just being able to chew. They're getting their youthful look they didn't know they wanted, and they're getting that confidence back that they didn't know they were going to get.
Good for you. Now you're training, and people need to know it's a real interview. I'm not siding with you on this interview, even though it's hard not to, right? You're a likable guy.
Thanks.
But you're always, not always, I guess, constantly, thousands of hours of continuing education, learning about different things about creating a natural smile.
Sure.
Is there that much to learn? When I hear thousands of hours after dental school?
Hundreds of hours every year for many years after dental school. And it was many years before we started going to these courses and saying, you know what, we're still learning a lot. Now we're starting to go to courses and we're going and saying, well, we're not learning as much as we were before. And that's a good thing. That's a good thing.
Okay, but you love this.
Yeah, absolutely. I was in a course just Saturday, a new course on root canals just on Saturday.
Is that right?
Yeah, absolutely.
So you do, and people need to know, so your practice, you do cosmetic dentistry, dental implants. What else do you do?
We do root canals when we're trying to save teeth. I may have mentioned that we do sleep apnea, dental treatment for sleep apnea. We're able to help people. You know, snoring at night is a sign that your body's not getting enough oxygen.
Okay.
And studies have shown that you can add 10 years to your life by treating sleep apnea. The most common medical treatment for sleep apnea is Cpap therapy. Now, that works great if you can hang a mask on your face and you're not claustrophobic.
Yeah, you brought one of those masks.
Absolutely. Love to show it to you.
Looks terrible.
Yeah, it's pretty intimidating.
Do you have people that were wearing those masks for CPAP that now they're not?
I don't ask anybody to go off their CPAP if that's working.
But have you had anybody?
Oh, absolutely. They come and say, I just can't wear this, you know, and they might kind of go, yeah, I'm flossing and I'm wearing my CPAP. They're not.
So these are people, so I understand this correctly. They're breathing fine during the day. But
absolutely.
when they lay down, they can't breathe
absolutely.
very well. So obviously there's there's something blocking it.
Their airway collapses.
So you make what? You make
an appliance that gently holds the jaw forward and opens up the airway. It goes from a very small pinhole to like a garden hose, and it allows the air to go in so they get the oxygen that it's in, and it works really good. And you know, the people who really like it is a lot of times the ladies who bring their husband in for the snoring treatment. So, you know, I think in America now they're building a lot of houses with 2 master bedrooms, and snoring is one of those reasons.
Interesting.
People don't want to sleep together.
So no
to keep
more
each other
snoring.
No more snoring.
That's your goal.
Dental
And do you
sleep
have
apnea.
certain people that slept in different rooms and now they're sleeping in the same room? I mean, do they tell you that?
I've heard that story. Yes. Yeah, I've got my husband back was the phrase I heard. I got my husband back.
Is that right? Okay, well, we have time for a few more.
Sure.
Attractive woman right there.
Sure, absolutely. Yes. Here's an example where a small change can make a big difference.
Take a look at that.
This is a nice smile. A lot of people would love to have that smile.
Mm-hmm.
Okay, but she didn't like the gap in there. She didn't like the way the teeth kind of
The front 2 teeth.
The front teeth, yeah, they kind of flared out and kind of tipped over. Didn't really like how that looked. And when she smiles really big, she could also see the gum height wasn't even. So she wanted those kind of things changed. So in just a few appointments with sedation, we were able to close that gap, make the teeth more.
Wow.
Yeah. And you see is this the same person? Yes, it is. But there's just, the hair is different. The earrings are different. And she dressed up for this photo. I don't know if she did or not, but the whole picture just pops. And
yeah. At the top of the show, we said small improvements can make a big difference.
Mm-hmm.
And like you said, all you did was the gap, Is that what you did? Any veneers or crowns or?
We used a laser to contour the gums,
Okay.
and we did veneers on 2 sides and crown. We replaced the 2 crowns in the middle, and we did some whitening throughout the rest of the mouth. Small
So
improvements
she
make a
takes
big
a little
difference.
nap, she wakes up, it's done.
Sure.
Do you have people that they love the fact that their trip to the dentist because they get to relax? Because I know with nitrous, personally, I love getting my teeth clean. Put the nitrous, it's like a day at the spa.
Sure.
But I'm not exaggerating.
Yeah, we have some people, some of our nurses that work in late night shifts. Goes, I love coming to get this done. I haven't had any sleep in a week. I can't wait to get this done.
Is that right?
Yeah, they're excited.
So what do you say? Okay, so patients are watching this. They haven't been to the dentist in 3, 5, 10 years. Or it hurts. They're in pain, especially guys, right? You told me they wait till the last minute
Sure.
where they literally can't eat. What do you say to these people that don't like their smile? They're starting to have discomfort with their, what do you say to them?
I would say, don't wait any longer. Come on in. Let's talk about what your options are. Let's see what's possible. Let's, one, get you out of pain. Let's find out what you would like your smile to look like, if that's why you're there. We have to listen to the patient. If they say they're wanting to fix the way they want to be able to chew again, they want to bite off a steak again, then that's what we give them.
Now there's 2 Dr. Hayeses though.
There's 2 Dr.
What do they
Hayeses.
call you when they're there? By your first names, like Dr. Sandy?
Dr. Sandy, Dr. Kevin. Sometimes I go by Dr. Hayes. As I've gotten older and a little silver around the hair, some of them start to talk to me Dr. Hayes.
Now
But
she
yeah,
says there's certain people that they'd rather deal with you. I mean, they
well,
love going
there's
to
a lot,
you.
There's a lot more that are Dr. Sandy patients, I think.
Is that right?
That's who I go to.
Is that right? She
Sure.
did yours?
Yeah.
You did her veneers, right?
We did many years ago.
I interviewed her. Beautiful
Yeah.
teeth.
They look good?
You did those.
I thought so. Yes.
And I feel like I could spot veneers.
Yeah.
Like, and they look natural. Very real.
Good.
Is that what you're trying to do? Like create something that
I don't want it to
obviously
look.
doesn't look fake?
I don't want it to look like a denture. I don't want it to look like crowns. I want it to look like natural teeth, but really nice natural teeth. Some people want to come in and get the Hollywood look, okay, and we can do the
You
Hollywood.
do that too.
Yeah, we
right.
enjoyed that too.
We're going to take a quick break. We're going to final message right after this. We'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. With us, we have Tennessee's dentist, Dr. Hayes. Dr. Hayes? Okay. So you have a few more photos. You said I've got to show a couple more.
Sure. You got a few more minutes here?
Yeah.
This young lady came in from another state, and you can see
Oh,
she
boy.
had some discolored teeth, some bonding that had been on there for a long time.
Is that unusual, by the way?
In the office, we see it. You're not going to see it, Randy, in public, because someone who has that smile, they're not going to show you their teeth. They're not
Sometimes
going
doesn't.
to smile.
Okay.
Yeah.
Now, she looks like she has the confidence where she smiles anyway.
Yeah.
Like she looks good.
Yeah, but it even gets better.
Okay.
Yeah, here's the after. Looky there.
Wow. Very nice.
Sure.
Yeah.
So you've got a good situation that became a great situation. If the before walks in, when she smiles, I'm going to look at her teeth. I'm not going to notice her eyes. I'm not going to notice she did a good job on her hair. I'm not going to notice that she dressed really nice, dressed for success. This picture walks in, or this person walks in, the after.
Yeah.
You know what? After you see that great smile, then you're going to see her eyes. Then you're going to notice her
Well,
hair.
look, she looks more sophisticated.
Yeah,
For sure.
sophisticated. She looks.
Almost
she
more
looks,
educated.
She
as
looks
well.
congruent. She looks
Okay.
congruent.
Okay.
Her eyes match her teeth, matches her hair, matches her outfit. Sometimes we say to people, you know, we want to get some teeth that matches the rest of you. Person we see.
So if they have
in
a
you.
big, good personality, positive,
Yeah,
you want to give a positive smile.
but they're hiding their smile. It doesn't match. It's not congruent. People see incongruence. We can give them congruence.
Okay, guys are coming in.
Yeah. You know, guys almost always want to be sedated. They're the last ones that want to admit it, but they do great with
Okay.
with the sedation. Yeah. Here's a young man who came in, wasn't happy with his smile, didn't like the colors, had some decayed teeth, some chipped teeth.
Oh boy. Okay.
Sure. We did some whitening. We did some porcelain crowns, and look at his eyes. Bam.
Very nice. You're right about that. Yeah.
Yeah.
Yeah, definitely.
If the windows are the soul to the eye, the key is in the smile.
Very nice. Very nice.
Okay. Got a couple more?
One more.
All right, great. This young man was in the military, served his country, very proud.
Okay.
While he was away, he had some things that went the wrong direction with his teeth. Now, a lot of people come in like this, and they think they're hopeless. They think, I'm going to have to have all my teeth taken out. There's no way we can turn things around. Not true. Not true. Here, look at that confident smile.
Very nice.
Yeah, absolutely. Now you see how he's still a little bit guarded, not quite showing all of the top teeth right there. He hadn't quite learned how to smile yet, but we're going to show him how to smile. We're going to show him how to really open up while he's doing it. Okay. He's a great guy.
Okay.
He's a great guy. Okay, got one more?
We got about 35 seconds left.
Oh, better go quick. All right, here's a young man who came in. He just wanted a more youthful smile. His teeth were worn, were tilted, and he just wanted to have something to smile about. Okay, right quick.
Okay, very nice.
Yeah.
Very nice.
Yeah, absolutely glows.
I want to thank you for coming on the show. We're out of time. So if somebody doesn't like their smile, make an appointment.
Call us, get in, talk to us, see what's possible, and let us help you give you a great smile.
Free consultations?
Sure. Come on in. You want to come first? You got a great smile.
I'll have to get over there one of these days.
Okay.
Pleasure to meet you, by the way.
Thank you.
Thanks. Appreciate it. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com. Just put in Dr. Hayes. Also, if you just got 10 minutes of this and you don't like your smile, you could go to Dr. Hayes' website and we'll give you a copy of this segment. So thanks again. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.